All right, welcome everyone. We are going to talk about how financial care drives ROI for frontline workers. And we're lucky to have with us today Mindy Field. She's Minneapolis business leader with Mercer. Ben McBurr, she's director of financial and retirement programs at UNA. Tom Spann, he's CEO and co-founder of Brightside. And Kathy Stewart, she's director of retirement programs at McKesson Corporation. Mindy?
All right. Well, thanks everyone for joining our session. I'm Mindy Field, and I lead Mercer's Minneapolis practice. So that includes our health, our wealth, as well as our career business. So I'm just honored to be here today to moderate this session about financial well-being and how it can really drive outcomes for not only participants and employees, but also for employers, and really calculating that ROI. So before we hop into introducing our speakers, we will save about 10 minutes at the end of the session for some Q&A. So be thinking of all of those curveball questions for us to hear from the experts here. So I will give you an opportunity to introduce yourself, Ben.
Okay, great. So Ben Roberge, Director of Financial Retirement Programs at UNA. Really happy to be here. For those of you that don't know who UNA is, we are an insurance provider, mostly in the workplace benefits space. We are celebrating our 175th year this year, so that's why the 175 is on the slide. And we're mostly focused on benefits to help the workplace get back to work, disability, vast, qualified benefits, dental, vision. Next slide. In terms of our workforce, so I'm in HR, so my customers are the employees. We have about 10,000 employees globally. The majority of them are in the US. We do also have offices in the UK, Ireland, and Poland. Our employees are spread out all over the country, but our main campuses are in Portland, Maine, which is where I work, Chattanooga, Tennessee, Columbia, South Carolina, and Baton Rouge, Louisiana. So we really spend a lot of time talking about benefits out in the marketplace, but also in our employees. It's really important for us to have a robust benefits package that support the first needs of our employees over there. Yeah.
Thank you. So I'm Kathy Stewart. I'm Director of Retirement Programs at McKesson. McKesson, we're based in Dallas. Headquarters moved from San Francisco to Dallas. We've got about 51,000 employees globally. We've got 28,000 in the US, and then we have about 12,000 distribution center workers. The company itself is all about healthcare. It's trying to improve healthcare outcomes for all. One product, one partner, one patient at a time is the mission. Fortune 10 company, $277 billion in fiscal year revenue. The four segments, we've got pharmaceutical, we've got medical surgical, which is selling to the doctors and the hospitals their supplies. Ran into a nurse this morning in the restroom. She's like, I love McKesson, my health is so good. And then we've got the international group, and we've got prescription technology, which is our newest, part of our latest acquisitions. We also help and support over 1.2 million patients with oncology. So we just set up a new joint venture, 1123, where we merged with Sarah Cannon Research Institute, and the idea is to better match patients to clinical research studies that are out there to help them battle their different cancers. So I'm in HR. I'm responsible only for the US, and we'll get to talking about Brightside in a minute.
I'm Tom Spann. I'm in charge of changing the slides. How am I doing? I'm also co-founder and CEO of Brightside. We created, it was actually the idea of Sean Levitt, some of you may know, was head of global benefits at Comcast. He studied that poor financial health was costing him $3,000 to $4,000 per employee, and came to me with the idea of saying, if we can make it easy for people to do the right things, people living paycheck to paycheck, we can help. So we've created what we call financial care, because we felt financial wellness was insufficient, just like it is on the health care side. People need sometimes urgent care, sometimes primary care, particularly the 70% of the country who's not financially healthy.
Yeah, that's right. We spent the morning really talking about well-being, I think specifically talking about the evolution of well-being, certainly because of the pandemic, but I think also because of individual needs and employee needs. So we're going to spend some time really diving into the financial pillar of well-being. The reality is that 7 out of 10 individuals are living paycheck to paycheck. And when individuals are financially stressed, it can have downstream impacts on things like their health, their productivity, certainly their happiness. We talked just in the earlier session about burnout, right? Financial stress can even lead and impact how we feel about burnout. I have a saying I like to say is that when wealth breaks down, so does health. And so let's spend some time talking about why financial health, why financial care. I would love to get the perspective from you, Ben, and from you, Kathy, on why is it important to your companies and really that you've started to focus on financial care for employees.
Yeah, I'm happy to start. So, and then you kind of we know that your well-being is all connected. So your physical, your emotional, your financial well-being are all connected. And if you're struggling financially, it's going to impact other parts of your well-being, which ultimately is going to impact work. So really important for employers to support that. I think we did it in a lot of traditional ways. We had a pretty robust competitive 401k plan, company match, and defined contribution. We had webinars that were offered for employees, self-help resources, but we were, assessing our employees constantly, and they were still mentioning financial well-being as their top stressors. So 3 of the top 5 stressors in our well-being surveys were coming up around finance-related budgeting, saving for the future, and emergency savings. So we knew that we needed to do something a little bit more than what we were currently doing, which is actually why we went out and looked for services that are in the space and ultimately landed on Brightside.
So we actually came about it in a different way. Our CEO went to a CEO roundtable in Washington, D.C. and was talking about social determinants of health, and decided that he would take that back and look at what was impacting our employees. And so our benefits team, along with HR business partners and several other organizations, put together a social determinants of health project in the team and a plan sponsor team. And we all started looking at all the different factors that impact, so they're a part of social determinants of health, right? I mean, you've got transportation and home and money, access to medical care, food, all that. And then I specifically took over the economic stability part, which as part of our retirement programs, as Ben said, right, you offer financial wellness, there's all this education out there, but somebody has to sit down and go out and watch the video. They have to learn it on their own and then try to apply it, and they don't have time, they don't do it. And our distribution center workers definitely living paycheck to paycheck. And so we brought Brightside in, and I think the difference is just astronomical. I was lucky enough to be in a distribution center one day when Brightside was there, and they would all speak. It was a bilingual session, and I didn't understand what they were talking about, but I understood at the end of the session, somebody walked up to the Brightside representative and showed their cell phone and said, "This is it. I'm $500 negative in my checking account. I need help like today." He said, "I cannot concentrate. I'm not productive. I shouldn't be here, but I need your help today." And they were able to help him. So it's been a wonderful, wonderful program because, like you said, financial wellness is not doing it. These people need more, I think, hand holding here.
Yeah.
More of a focus.
And I think when we talk about financial wellness, and I think just how that's even evolved, what I think is interesting is, you both talked about retirement programs. And I think the reality is that what financial care specifically can do is, if we think about the people that need that help the most, they can't even save for retirement. They need help in the day-to-day and managing their day-to-day finances before they can even start to save for that long-term planning and that long-term savings. So I think that's the really the great and interesting thing about how financial care is really an integral piece of that holistic financial wellness.
It's fun to hear you guys talk about this as it relates to people's health care, right? Because my background is I ran healthcare at Accenture, then started at Accolade, and then when I started Brightside, people said, "Oh, you're getting out of healthcare." It's like, no way, like financial health is the biggest determinant of life expectancy. It's the biggest cause of stress. It's making people sick. And then, the social determinant of health point, Kathy, it's keeping people from getting better. There's a great book called Poverty and the Myths of Healthcare Reform that says it drives 30% of all healthcare costs in this country for those reasons. And I guess the other thing I'd add as a reason to tackle this is the DEI issue, right? You mentioned you went to a bilingual session at McKesson, we're engaging Latinos and Blacks at a much higher rate than whites because they're more likely to be financially sick, right? They're not coming in with the generational wealth. They have 10% of the net worth of whites. Women are 50% more likely to be financially sick, right? How do you expect these people to show up as their best selves and retain and promote them when they've got this unbelievable stress and it's not, their families and communities don't support them. They're actually draining. You could to pay equity, but they're still, they are in these families, communities that, damage their financial health.
Yeah, that's great. I want to talk a little bit about, the financial wellness space, and we all probably know this. There's lots of options available. So I am curious, and then we'll transition to dive a little bit deeper into ROI. But Ben and Kathy, as you were thinking about, and Kathy, you shared a little bit about, social determinants of health already. But Ben, specifically, as you were looking at the market and thinking about, gosh, we want to do financial wellness. We want to really focus on financial wellness. We want financial care. What did that look like for you?
Yeah, that's a good question. So we did a lot of research before we even opened up competitive. Anytime we're implementing a new program or solution at a company our size, especially if it's going to be a significant investment, we do a competitive source review. So we surveyed the marketplace to see what was out there and then opened up the bid. And the things that really were important to us were that it wasn't just a microsite or a place for folks to go and get, information on their own, because that's great, but in reality, that's not going to move the needle on the care that we need to provide our employees. So we were really looking for a service that would offer human element, where an employee would pick up the phone or schedule time through an app and connect with a real life person on the other side to go over whatever we need to go over from a financial care perspective. So that was a really important factor for us. Another important factor for us was that whoever we ended up partnering with was going to be solely focused on improving financial care for our employees. And that was, there wasn't going to be any soft level costs or alternative motives for that to recommend certain programs. They truly were there just to support the employee and however that showed up. So finding a partner that would understand our employees' needs, help them work through it, and take it the next step of maybe they're calling in an acute need, but they can help set up healthy habits for financial care going forward so their long-term success. So those are certain things that we were looking at during the process. We're also looking for something that integrated with our HRIS system, use Workday, and Brightside is going to fit all of those lines for us.
That's great. Kathy, you have anything to add on that?
No, I mean, I agree with everything that he's saying.
+1 to all of that.
Yeah.
All right. So I know we're here to talk a little bit about ROI. And ROI, there's so many ways to measure things, right? And there's so many benefits. And that's how we make pitches for what we want to implement, right? It's like, well, what's that return on investment? And so and every company measures it differently, right? So what might be important to Kathy might be very different for you, Ben. And so tell us a little bit about your measurement strategy for outcomes around financial care and how that, maybe can help some of our guests here to think about, hey, this could fit for, something that we want to do with our workers.
Yeah, happy to start. So there's kind of two different things of ROI. ROI would be, in my space, is making sure that our employees are satisfied with the service, they're getting what they need from it, and it's improving outcomes. And then ROI that we're reporting to leadership also has to come down to okay, can we justify the cost of a program like this? So we're seeing that on both sides. Anecdotally, the feedback that we get from our employees that engage with Brightside is super positive. Some really, really powerful stories across the candid too. So we have lower income employees that are struggling to live a paycheck to paycheck, struggling to figure out how they're going to afford to put a roof over their head next month. They've engaged with Brightside, changed a couple habits, and they're in the workspace. But you can be financially sick at any income level. It doesn't just impact lower income employees. So we're also seeing some healthy habits from our employees that you traditionally wouldn't think need this because they're making a lot of money or enough money to survive in areas of living in. But they're doing things like paying $1,000 a month for a car lease and not saving for retirement. So we're seeing a lot of anecdotal feedback there. In terms of actual measures that we report out to leadership, we have a few key ones that we're reporting on. Employee satisfaction is important to them too. So our NPS score with Brightside is around 93 right now, which is far above most any other NPS score I've ever seen. But we're also seeing that our employees that engage with Brightside are 50% less likely to turn over to leave the company than those that aren't. And there's a real dollar cost to that. So that metric alone is paying for this service. And then Brightside also reports back to us in terms of what they're saving for our employees that do engage with them. So they have kind of metrics where they can let us know on average for employees that work with the Brightside financial assistant, this is the dollar amount that they're saving in things like high interest loans that they wouldn't have otherwise consolidated, get over with $1,000 current lease, for example. So we have a lot of different powerful metrics on top of super positive employee feedback that is not ROI like this for us.
So we started it looking at, again, social determinants of health, and we had a bunch of metrics that we put together from the health literacy side to the economic stability. And the one measure that we had put one in initially, and it was to see a reduction in 401k hardship withdrawals, because we know that people were taking them every pay period or every month to just subsidize their income, right? Which tells us a story of how they are feeling financially. We piloted across, I guess, 3 locations, 4 distribution centers, about 1,200 employees, and what we've seen is a 5% reduction in hardship withdrawals. We were expecting 2 or 3, and we actually came back with 5% reduction, which was fantastic. We also then were a benefit of seeing the reduction in turnover, right? So if you take the pilot DCs and you look at those that are engaged with Brightside versus those that are not engaged, the turnover rate's 43%. Those that are engaged, 10%. That was like a 76% reduction. It was huge, which again is cost savings when you have to then backfill those positions and train them and do all that. Our NPS score is a little higher. It's 100 right now. Wow. I hope you guys can maintain it. There's about a 25% response rate, but it has been 100% at 100. I was shocked. But the stories, again, the case stories, the real life stories that they come back and tell, or Brightside comes back and they tell us the real life stories of how they're impacting our employees. So we don't know who the employee is or where they are, but they do report back to us. And the stories are just incredible. The turnaround, we had one guy living in a car. He was divorced and was living in a car, and partially in a car some nights and then in a hotel other nights because he didn't have enough money to put down payment on an apartment. Within 7 days, Brightside helped him obtain the loan he needed to get into the apartment, and now he's got a savings account. So it's just you can't put a measurement on that, right? Mm-hmm. I mean, that's the hard part. But yeah, otherwise it's ROI, definitely ROI on the turnover, and hopefully higher reduction in hardship withdrawals and greater savings rate, right?
Yeah, that's great. Because I always think of engagement as we always struggle with engagement. One is getting people to use the thing, right? Second is what did they do when they used the thing? And then the third piece is the golden ticket that we're all looking for is how does that translate to everything else, right? And in a former life that I had, really focusing on how do we take that ROI even deeper? Can we connect to healthcare claims costs and make those other connections across the benefits space as referrals to maybe it's the mental health program. And because we saw this, they didn't have that hardship or whatever, or they used Brightside and they didn't do this. I think it's just making those connections. That's really that golden unicorn we're all looking for.
Productivity, safety.
Mm-hmm. Yeah, huge impact on safety and finding that measurement, right? Yeah.
So, Mindy, one of the things that came up this morning with Raquel's discussion, people don't know the benefits they have.
Yeah.
And I think part of that is it's a false assumption to say they know what they're looking for. Right? They just know their life situation, right? Mm-hmm. And I think about the story of the woman who comes back from having her third baby. She's got 2 preschool kids, comes home to find herself evicted from the hospital with her newborn. She didn't know. What she wanted was, I heard you guys could help me find a place to live, and right. This is not traditional, CFP financial wellness stuff, right? This is like, I've got to get this woman on her feet so she doesn't get fired or whatever else at her fulfillment center job. And we find all that stuff, but we also, it's a little sketchy that she got evicted. And so she had a free legal benefit from her employer that she didn't know she had. We pointed her to that. She now owns the house she got evicted from. She won $150,000 settlement just on the pain suffering plus all her stuff that she lost in that eviction. And then it took like 3 months for that process.
Super powerful stories. And that in and of itself it's hard to put a measurement on that, right? But those powerful stories are really resonate with, certainly with senior leadership and with all of us as well. So as you think about, you shared a little bit about what you're most proud of, in the ROIs and things that you've measured, how you've made an impact, how you've made a difference. Any learnings in the process? We all have to take a time and reflect on, oh gosh, maybe that didn't go so well, or I would have done that differently had I had the foresight to do it.
So I have a couple examples. We implemented weekly July 4th, and that's many of our employees are in Maine. We had about 3 good months of time. So that was probably not the best time to implement. We didn't have as much focus on it because of that. So I might have changed what we implemented to line up more closely with our benefits enrollment or some other event happening where we could have really tied in financial care. And then the other learning, when we originally implemented Brightside, our corporate communications area really wanted to control messaging going to employees, and was a little restrictive on when we would allow Brightside to directly communicate with our employees, which wasn't leading to as much engagement as we were hoping for. And we've since more closely aligned our strategy to allow them to communicate and also tying it more in with our company events that are going on. So that's really helped engagement. So those would be the 2 things that I would say for key learnings of what we could have done a little bit better.
So again, we definitely learned something through social determinants of health. So we rolled it out as a voluntary program. So at the same time that we rolled out financial care, we rolled out health literacy. So we were helping people we would educate them and hold mandatory sessions that they had to attend regarding, chronic conditions or know your numbers, just different topics to educate them. And those sessions were mandatory. So we thought, let's make financial care voluntary. And we had Brightside in the cafeteria set up in the break room where people could come up and ask them with their little trinkets, grab a trinket, grab a snack, talk to them, find out what they do. And what we found is engagement was really low. And so, if you think about finances as a really personal thing, I know I myself would not walk up to another financial person in front of all my peers to admit, hey, I need some help with financial counseling or whatever. So we made it mandatory, which, I don't know if the distribution center leaders necessarily appreciate it. I think in the end they will because they will see all the ROI. But we made it mandatory. And so, all these employees will start coming in, and we use Brightside to help us figure out what were the top reasons people were calling in. Emergency savings, budgeting, debt, and I don't even remember the last one. It's the same one.
Credit score.
That's it, credit score. Improving credit scores. And so we've held mandatory education classes on how do you increase your credit score? How do you budget? How do you put a budget together? And during those sessions, we were also explaining to them exactly what Brightside did and how they helped other people. And our engagement went from under 10% to 35% this week. So it's a huge, huge increase.
Yeah. And it's important to know that those sessions didn't count as engagement. Right.
Exactly.
It's actually, it's 35% of the population working with a financial assistant on a meeting basis. God.
Absolutely.
I mean, the point of the business was to drive ROI. It was this $3,000 to $4,000 per employee that Sean brought to me. And to do that, you've got to do two things. One is you've got to engage the financially sick people, right? And they don't view financial planning as a relevant product. They don't view financial education as a relevant product. They think they'll be told they're doing it wrong, right? And so they're not going to proactively engage in that kind of stuff. So one approach is Kathy's approach. And at another employer, we piloted in 12 states. And people started trickling in from other states. They started hearing about it. And at some point, that employer, they said, okay, these are all people who need this service, right? And it became 50% of the volume all of a sudden, these out of pilot people. And we had to shut it off temporarily. But when people understand you have real solutions for them in an emergency, right? Once they're aware that you get them, you've got that engagement. But we've got products like no credit check loans that are tied to the paycheck, right? At a credit card interest rate, not the payday lending interest rates they pay otherwise. We've got other kinds of loans for people with a little bit better credit score that can save them half of their interest expense, right? That's real money in their pocket if they're paying $1,000 in interest every month, and now they're paying $500 in interest. They can start to see their way to paying off that debt, right? A savings account with a couple clicks, right? We get, in the population Mindy's familiar with, we got 50% of the population saving out of every paycheck every week on average $18, gets $1,000 a year, right? And so it's those kinds of real simple solutions, many of which take advantage of being tied to the paycheck, that start to drive results. I mean, the key to behavioral economics is, Richard Thaler, who won the Nobel Prize, said, behavioral economists don't believe people are stupid, they believe the world is hard. So how do you make the right thing easy to do in a very complex situation?
And Tom, what I like so much about Brightside is you have your whole research area that help employees in their vicinity to find resources, whether it be a food pantry down the street that can help with groceries, or whether it's some program that can help with their internet connectivity and lower their bills. That's stuff that our employees don't have time to research on their own. But your research department, they do it all, right? For all the vicinities where the employees live and help them find community-based resources.
Yeah, I mean, you think about the story of the woman who was evicted, it's finding those resources. During the pandemic, so this is a slightly old statistic, but the U.S. government had reports food and housing insecurity by state. And, the average percentage of households in 2021, I think, that was housing insecure was like 24%. This is not, Texas was 27%.
Right.
If you think your people do not worry about losing their apartment or losing their transportation to get to work or, not being able to put food on the table, if you've got a real frontline workforce, whether it's white collar like Ben's, or fulfillment center workers, I highly encourage you to dig in. I'd be happy to help you understand with data, not with.
Yeah, that's right. Backed up by data. Yeah. We're going to turn to the audience, but I do want to ask this question because I feel like this might come up from our audience. There might be a question from leadership or about okay, well, we're going to offer financial care services for employees. How's that going to show up? Are people going to say we're just not paying people enough? And why don't we just pay people more? I think that's something very relative that could be part of the conversation. So what's the response to that? Why don't you just pay people more, Ben?
Yeah. To be honest with you, we have to do that because the market has dictated it. But I think if you think about what this program costs, if you were to put that in paychecks, advertisers, they're going to get nervous. And we've talked about this a little bit already. If you can still be financially sick and have bad habits around financial well-being, even if you're making more money.
Right.
It's not necessarily correcting the problem. It's just kind of putting a Band-Aid on it. So the ROI for the cost of a program like this is kind of a no-brainer for us. And in terms of if we just gave that money back to our employees, it would really make a true impact on the paycheck.
That's so true, because you've got people making six figures that are still financially sick, right? You give them more, they'll spend more. It's not going to change their habits. It's not going to change, and that's what you need to do is change their spending habits, change the way they look at all of it. And the only way to do that really is through financial care.
Yeah, Ben, you mentioned what we call the ATI number, we call it after-tax income, because money we're putting in people's pockets, right? And it doesn't count a lot of stuff, real money, right? If their credit score goes up 100 points, they can refinance their car loan. We may not even know that they refinance their car loan. We can't count that kind of stuff. If we point them to a food bank, they may keep going for weeks, and we don't include a lot of that stuff in there. But it's like $1,000 per employee per year. I can tell you, we don't cost $1,000 per employee per year. If you want to pay that, come see me. But you can put more money in your employee pockets through, and particularly the ones that need it the most, by just taking things out of their lives that aren't creating value for their lives, right? In the end, money should be about how do I live my best life. We're a no judgment place. You spend on shoes, tattoos, we don't care, right? What do you want to do with your money? You shouldn't spend it on interest. You shouldn't spend it on banking. There's just a lot of junk you should spend it on. And so how do we get your money going to the things that matter most? Take that other money, free it up to do those things. That's much better for that employee than a raise. Forgetting all the other benefits and ROI that you guys get.
Yeah. One other thing to add too, a service like this also helps engagement in your programs. Like you mentioned, Tom, there's legal service that an employee would know about if they can talk to Brightside. We've seen that quite a bit with our employee population. And we're getting that feedback from our Brightside complex. Like, this is the question that came up. There's a demand for this type of benefit, so it helps inform you as a general organization.
And I think there's a lot of connections between benefits that if somebody calls Brightside for a specific stress or a specific need, there's likely another benefit that they would benefit from. So having that point of contact that can help make that connection for them. Oh, did you know you have an EAP program? Or did you know that you have a disaster relief fund that you can apply for within your organization? So bringing those things into the conversation, because we know how much all the great things that we offer employees. And so having that point solution to be able to help them make that connection is really important as well.
And we're actually going to be offering, or Brightside will be offering an HSA class coming up about why you want to contribute to an HSA and all the tax advantages. And they're going to be offering that third quarter right before annual enrollment in October.
That's great. Brightside has a booth out in the exhibit hall, so make sure to come ask any additional questions, connect with our speakers on LinkedIn, and be well. Thank you.
Thank you.
Thanks very much, Mindy, Ben, Tom, Kathy. Really appreciate it.